In oculoplastics, you can use it for external photography or for slit-lamp photography, as Dr. Fogla just mentioned. And this photograph below is one which is taken by external photography, but by attaching a macro lens to your camera. What is the need and importance of photography? We've already had Dr. Yogesha and Dr. Fogla mention this to us, that it's a better document instructions. You can take a second opinion from some other colleague. It is indispensable in reconstructive surgery. You can very well use it for student-patient education modules. For trauma, it has medical legal implications. You need to have a pre and post photograph. Certain times, insurance companies do not pass on the claim saying that nothing actually has happened with the patient, and you can actually show that this was pre and this is post. Commonly, it is used by oculoplastic surgeons and by pediatric ophthalmologists. Now, what are your basic adjustments? You need a dedicated room or a wall. If you do not have a dedicated room, what you can do is you can paint a small wooden board with a light grey color and use it as a background. So in front of your arm, in front of the patient's chair on a chair unit, you just put that small wooden board and ask the patient to rest with the head against it, so that you have a uniform background to all the pictures that you're going to take subsequently for the patient. The best recommended is a light grey background with the patient seated in front of it. You should have adequate space around the patient so that you can move around and take oblique frames, and also ask the patient to turn around for oblique and 90-degree frames. And usually all your photographs should be in a standard frame to allow comparison between post-operative visits. Like this is a lady and in ophthalmos and has undergone surgery, and when the frames are exactly comparable, you can explain it better. Or like this gentleman who has dermatochalasis with ptosis and has undergone both the procedures, first post-operative day 1 week and then at 6 weeks. And this also helps you educate your patients that this is how you're going to look immediately post-surgery, and this is your downtime, so expect about a week's edema. So the patients are usually worried, how will I look, how can I go out, can I go to parties? So this is how you can explain it to them if you've taken good photographs. We have discussed a lot about camera specifications. Dr. Gaurav has very well mentioned it, but we just go through a few small points, like the photo clarity in smartphones is a little poor in low illumination. So you need good ambient light. The subject should be facing the light source and has to be well illuminated. The smartphones have an inbuilt flash, and most of the times it is a LED flash, which is usually very bright. So the photograph might look artificially over illuminated. Hence, it is always best to have good room light and avoid the external flash while taking external photography. However, if still your flash is needed, you can use a transparent white a little transparent white thin paper over the flash, and that reduces the intensity of the flash. Look at this image down. This is an image of a girl with natural light only and no flash used. This is with the built-in flash of the smartphone, and you can see that it looks artificially whiter. Whereas this is what is best, and if you can have this, then it is the best thing. It is an external flash which bounces off the ceiling. So it's not the inbuilt flash of your iPhone, but you use external flashes. I'll speak to you about that. I don't have any financial interest in these products, but there is one external flash called the iBlazer, which is available, and it is a fully synchronized flash with either the Android or the Apple products. Now, unfortunately, all smartphones have a built-in digital zoom. There are two kinds of zoom. One is a digital zoom and the other is an optical zoom. If you get optical zoom, it's nothing like it. That is supposed to be the best sort of image, like you can see over here. This is the original image. When it is zoomed with an optical device, with an optical zoom, you get much clearer picture as against a digital zoom, where the image tends to get pixelated if you magnify. So suppose there is a patient who has a wart on the upper eyelid, and you want to take a close picture. It's always better to not zoom, since your phones have a digital zoom. You take a picture from a particular distance, and then after you have clicked it, then while you want to present it somewhere, you can expand it has been captured with an optical zoom. And you can see the ocular surface formous neoplasia with the very small filiform intrinsic vascularity. This would not have been possible just with a digital zoom. Now while you are transferring, like we mentioned about WhatsApp and emailing photographs, so when you are transferring your image, make sure that you always transfer the image in the actual size. It takes a little time, but it maintains the resolution. Quite a high extent in the auto mode in the iPhone and to some extent in the Samsung. However, other smartphone platforms, you might have to go into the manual mode and then increase or decrease your exposure, the contrast and all those things. Color levels are very acceptable with the iPhone and the Samsung platform. For some others, you might have to adjust the red, blue and the green colors. Increasing the red color a little bit gives the skin tone a very natural color. You'll see that in the pictures to come. And there are several apps available with which you can edit your photograph once you've clicked it before making your final presentation. There is an app which is known as the Camera Plus app where you have a burst mode. So what it does is that it takes a series of photos quickly with one click. So you click and it takes about 20 to 25 photographs within a second span, and you can select the best picture amongst those to make your final presentation. So instead of you click, you just click once and it takes 20 photographs and you select what you want. It also has an anti-shake mode where what it does is your vibrations of your hand while you're holding the camera are reduced. That is what the phone senses itself, and it clicks the image at the point when your hand's vibrations are the least. Now in oculoplasty, you'll have certain views or certain standard ways in which you should take photographs. For the face views, you have the frontal, oblique and the lateral, and all these together are known as the standard 5 head series in oculofacial and plastic surgery. So what you take in the frontal view is from the upper limit of your head to the jugular incisional view. So you take from the upper limit of the head to just below the neck. This is what a frontal photograph should look like. In particular type of conditions, you take additional pictures. Like in this lady who is very conscious about the lower eyelid bags, you also take a picture with up gaze and down gaze to scientifically document that yes, when she's looking down, the bags become less obvious, and that means she has fat prolapse in the lower eyelid rather than fluid accumulation. And this is very well taken by people when you present it to the cheek and then take the pictures. And for the 90-degree view, either make the patient turn around completely or just twist the neck and take the pictures. For the eye views, for ptosis particularly, you should take a standard photograph in cardinal gaze, in up gaze, down gaze and with the eyelids closed. And certain other conditions like proptosis you would have to take in the bird's eye view so that you can document proptosis and hemophthalmos in such patients. Certain other special views as custom made for the situation can be used, like to document lid laxity, you can click from above or from the side, but this is all personalized photography. Thank you very much. And,
thank you very much.